Hello. The following information is intended to bring awareness to cannabis use disorder. They are not intended to demonize those who use cannabis or cannabis itself, but to rather present a better understanding of cannabis use and its effects. Cannabis use disorder is a persistent and problematic use of cannabis despite significant impairment. It is the most commonly used drug in the United States. Cannabis, also known as marijuana, is derived from the cannabis sativa plant, which contains the most commonly known cannabinoids, tetrahydrocannabinol, or THC, and cannabidiol, CBD. These cannabinoids are what produces the mind-altering effects in users. Cannabis has been used in many different ways. It can be smoked like cigarettes through joints, cigars through blunts, or by using pipes or bongs. Cannabis has also been found to be mixed into foods and teas to create edibles. Over the years, oils from the cannabis plant have been used medically to relieve muscle pain, soreness, inflammation, seizures, and several other conditions. About 159 million people use cannabis, which is more than 3.8% of the world's population. 22 million people worldwide meet the criteria for cannabis use disorder, including 4 million people from the United States. Cannabis use disorder affects about 30% of its users, 3.4% between ages 12 to 17, and 1.5% among adults 18 and older. Cannabis use disorder also affects males more than females. 2.2% of adult males will develop cannabis use disorder, whereas only about 0.8% of females will develop the disorder. The overall use of cannabis increased from 10.4% to 15.3%, and the day-to-day use increased from 1.9% to 4.2% over the past several years. Now, I know what you must be thinking. Marijuana isn't bad for you. It's not addictive, right? Well, actually, cannabis use and cannabis use disorder are highly comorbid with other substances and substance use disorders. Cannabis use has been associated with poor life satisfaction and suicide. Individuals with a long diagnosis have high rates of coexisting mental disorders, such as depression, anxiety, bipolar 1, PTSD, and many more. Oftentimes, the experience a person has with the substance can overtake his or her ability to function in a normal environment. Cannabis use alters the body's endocannabinoid system, which helps the body regulate various cognitive functions and processes, such as memory, mood, sensory processes, appetite, and pregnancy. Over time, this can lead to cannabis dependency and abuse. Have you ever craved cannabis? Spent a great amount of time under its influence? Has your tolerance to cannabis increased over time in order to achieve the desired effect? Have you ever lost your job, your friends, your family, or your social life due to cannabis use, but you still cannot seem to stop? You may have a problem. If you or a loved one are experiencing the symptoms of cannabis use disorder, you're not alone. Don't be afraid to ask for help. Call 1-800-662-HELP.